And all right, good morning. Good morning, everyone, and welcome to the part two of our discussions regarding growth and development. But before we proceed, start with our session, just give me your feedback, any questions, any doubts, or anything that you have learned, a word or two regarding what we have discussed last week. So for those who have not joined or maybe patulog-tulog last time, so this is your time to review also. Okay, I'll start with Ahmed.
Okay, yeah. Last week we learned about development and then growth.
Do you
And it
remember
inspired
the
me so
difference?
much. Yes, please. Development is a maturity state in an individual that cannot be seen physically. It deals with the emotional and the social development of the person. So it's something that a growth in an individual that you cannot see, but it takes place within the mental and the person's emotional and then the social stage of the person. And then when we talk about growth also, growth is the physical development of an individual, which entails the size of your body and then your organs as well. That one, you can even see it yourself.
I super agree. That's 100% correct. Thank you, Ahmed. Who else would like to share? Jennifer.
Emotional development, sir.
Okay, tell me about that.
Afraid of the dark. Tends to impatient and selfish. What else?
Yeah, I think it was
Show
in the toddler stage where they are fearful of the dark. Am I right? So
yes,
now that you have that knowledge, being a CNA or being a caregiver, it's best that you do not make darkness as part of your panakot or to threaten a toddler or growing toddler, because for us it's cute, but for them, you don't understand what's going on in their mind, so do not use na okay, sige, kakainin ka ng mumo in the dark or something like that. So instead you put a like a small light, or what do you call that, yung small light, a lamp, overnight, and then practice habits na before going to bed. The toddler should go to the bathroom first, and then what else, and then yeah, just keep it a habit na not to threaten the child of the dark. Okay,
yes.
thanks, Jennifer. Next, who else?
Yes.
Almir, who else? Maria.
Yes,
Maria
Maria.
Fe.
Yeah, sorry. We also talk about fontanelle. You have two kinds of fontanelle for our head, like the baby. We study about the posterior and the anterior fontanelle. The
Fontanelle.
posterior is should we focus found on the back of our, should be on the back. You can found it, and the anterior fontanelle is will found on the front.
Okay, thank you. Fontanelle. Okay, fontanelle. Yeah. So anterior, it's diamond shape and it will take a while before it closes. While the posterior, tandaan nyo lang, letter A is in front, yung letter P is at the back. Okay. Posterior fontanelle or bunbunan at the back is it's a triangular in shape, and then it will close at the end of 1 month. Okay. Next. Marianne.
Good morning, sir.
Good morning.
Can you hear me? Okay.
Of course.
I would say, last week we discussed about growth and development, and it says that growth and development includes not only the physical changes that occurs from infancy to adolescence, but also about the changes in emotions and personality and also behavior, like thinking and speech of children as they begin to understand and interact with the world around them.
Oh, I like that. Thank you. Who else? Lou.
Last week, sir, we discussed about the newborn reflexes, the Babinski reflex.
Okay. What was that? Ano ulit yung Babinski reflex?
The one that we pinch in the foot of a baby.
Yes. So if
So
this
that
is
you
the
have
sole of the foot of
response.
the baby, you put letter
Yeah,
J or letter S to what?
yeah,
Elicit response, right?
yeah.
Okay, that's it. Thank you, Lou. Next, Jennifer.
Sir, we have principles of growth and development like infancy, adolescence, and preschooler, and
Pwede mo ba siyang isunod-sunod? So infancy muna, and then after 1 year, the infant becomes a
toddler,
yes. After 4 years old, the toddler becomes a
preschooler,
preschooler. Yes, and
Preschooler.
then once you start going to the yung formal school, you call them school age, and then it becomes a teenager. You
and then
become adolescence, and then finally you have adulthood. Adulthood is also divided into 3 groups. You have your early adulthood before kayo mag-40. Remember, 40 years old, that's life starts in 40. So para lang matandaan ninyo. And then 40 to 60 years old, 60 usually is the time where our parents will retire. So that's also your parang cue. And then finally, late adulthood. All right, thank you, Jan. How about Melinda? What did you learn? Sorry, Elmira muna.
Sir, when it comes to infancy, we have this kind of situation that we call SIDS, which is the sudden infant death syndrome. The causes of this is when they leave or the parent or the one who's attending the baby left the baby has this thick blanket or a support of anything which is thick on her side that can cause a death, sudden death.
So how
And
do
the
we avoid that?
FTC, so we need to at least keep them only on a circle area which they can they cannot cause the death of this. They should remove the anything that can cause of that.
Okay na yun.
And then
Next.
for the FTT, the
Okay
failure
na yan.
child.
Isa lang. Next, Joshelle. Thank you,
lang.
Mira. Isa lang.
We discussed also last week regarding the puberty. For example, the puberty is the process of physical changes in our body. For example, in the girls, hair under the armpit. Then the girls having the periods. Then the breast is getting big. It's the example of the puberty.
Okay, yun kay Joshelle, the example, that's what we call the secondary sex characteristics for women, right? So for men naman, we have also hair growth. What do you call the hair that grows on the top of the lips?
Mustache.
Mustache. Ito naman,
Bird.
bird. Pag bird yan, baka tukain ka.
Bird.
Bird or beard?
Beard. Yes, sir.
Beard.
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 Okay. Para lang siyang,
Beard.
imagine beer. Okay, parang uminom ka ng beer. Lagyan mo ng letter D. Beard. Okay. Pag bird, ingat ka, baka
Iba
makalipad.
yun.
Okay. Next, ano naman yung armpit hair naman sa kulikili, right? How about yung hair sa private part or private organs? We call that pubic hair. Ano naman yung hair mo, yung between your pubic hair and your tummy?
Rogue.
Karug, sir. Karug.
Karug. Ano yung karug? Ano yung karug,
Karugtong,
Asis?
sir.
Karugtong.
Karugtong, sir.
Karugtong.
Sa Bisaya, what is that? In Bisaya, it's called bulkat. You know what's bulkat? Ask me what.
What?
What?
Ano po?
Bulbul
Bulkat,
nga
sir.
ni Katkat. Okay. Oh, ayan. Bulkat. Bulbul nga ni Katkat. Joke lang. Okay. Hi, Christine. Ano naman natutunan mo from last week's discussion?
hello sir, good morning po. Yung isa sa mga tumatak sa akin sir, yung 5 stages for coping of that with acronyms of DAPDA for us to easily remember. D is the first stage is the denial, anger. The next one is anger. B for bargaining. And the fourth one is depression. And the fifth one, as mentioned, as what Sir Richard mentioned, is the hardest part, the acceptance,
Yes,
where
thanks,
it is more
Christine.
prone of suicidal. Okay.
Okay.
Thank you.
Thank you so much. Now, that is according to Dobler-Ross na model, okay? Dobler-Ross is a psychologist, doctor siya. Pero isn't it that in reality, the grieving process is really different from one person to another, right? Now, sometimes we go through anger first, and then we deny, and then we go through acceptance, and then after a few years, again, we miss our parents, we miss the person that we love, and then you go back to depression again. So in reality, it's really not linear. Hindi yung sunod-sunod talaga. But according to what I've already discussed is just the model, okay? Where the psychologist, yung mga medical team follows, which is for you guys as a CNA, you have to understand that when people goes through that stage, either either DABDA, that it's not them per se, okay? It's a situation that will lead them to become angry at you, or to become depressed, meaning that they don't want to participate in any activities, they don't want to be socialized with people, they don't want to take a bath, they don't want to take their medicine. So you just have to really understand the situation. Again, that's called empathy, right, Ahmed? Okay. Don't sympathize, but empathize. So you have to understand
Okay.
that when they are not responding to you, Mr. Johnson, I'll be giving you a medicine. Then Mr. Johnson, I don't want that medicine. So and then you understand that they're just going through grieving process. Okay. So for me, one thing that I've learned from that model is that, again, hindi siya linear. It means that it doesn't follow for everyone. Sometimes you would wonder why people in the funeral, why some people really cry out loud, right? You know, but some people, they just don't cry at all. Then you would you would say na, ano ba nangyayari sa'yo? Hindi ka ba malungkot? Are you not sad that mama is gone? Then I realized that, the grieving is different from one person to another. Sometimes it takes time for other people, and sometimes they can quickly recover out of that. And then sometimes naman, they can quickly recover, and then later on, once they reach adulthood, for example, and then they realize na they don't have parents anymore. If they see in the mall na, your other people like pushing the wheelchair of their old grandparents or their parents, then you kind of miss that kind of experience which you did not have growing up. Then sometimes you go through depression again because you were not able to let's say you were not able to manage, or let's say parang process your experience before when you lost someone. But then again, also one thing that I've learned from that is it's not only when somebody passes on, when somebody dies, it's also when something that you really like and love lost. For example, your pet dogs, or let's say if you have cancer, your breast or your legs, if you have diabetes, if they amputate your legs, stuff like that. Okay, when there's a fire, basta pag mawalan ka ng something, yun yung grieving process, which is dabdab. Okay, thank you, Christine. Who else? Belinda? Ivy?
Yes, sir.
Melinda?
Hi, sir. Regarding infancy, solitary, the word of solitary, that can can be happy on their own and no need
Ikaw ba
for
yun? Okay, so let's just rewind on that. For the babies, as a CNA, what you can give them or offer them as part of their parang play or playtime is yung anything that na they will be happy on their own. So think about that. Na why is playtime important for children? Actually, guys, this playtime is important for them because it is when they will develop both in yung sa what Ahmed said, the development stage. So whenever they press on something, part of your physical action, it creates sound or something. Now they would learn, that's part of their learning, that they would hear a sound. It will move, so they will see them move. So it's still part of their development. So like for example, yung bola, yung toy, and then there's some pebbles inside, and then when you shake the ball or the toy, it creates a sound. Now when they click on something, it creates a sound. So they are learning at the same time as well. So that's part of their development. Okay? Thank you. Next, sino pa? Sino pa bang hindi ko natatawag? Andrea, hi.
Yes, sir. Reflexes ko, Ruthie.
Ha?
Rooting
Oh, rooting
reflexes.
reflex. Okay.
Stroking of the infant's cheek, sir.
Yes, for feeding. Thank you. Okay, rooting
Yes.
reflex. What else? Ivy,
Ako, sir.
Sarah.
Jane, sir. Last week, we learned also about bulimia. This is the person that eating a lot but not getting fat. And also we learned the anoxia nervosa, if am I right, sir?
Anorexia.
Anorexia. Yeah. This is the person that she's very thin but she feel like she's a fat.
Yes. Why is it close to your heart? Do you experience anyone like that? Or do you know anyone who's going through that? Bakit yan ang napili
Yung
mo?
mga because sometimes, sir, I admit it sometimes that I feel also like that. I feel like I am fat even though I'm just 55 kg like this. I feel like I want to lesser my food like this.
Okay,
Diet.
now I think yours naman is not really a problem because you know, physically you're still healthy, wala pa o hindi pa naglalak ng nutrition. But for these people who are diagnosed, okay, again, let me highlight that it should be diagnosed by a clinician that you are bulimic or you are anorexic, okay? Hindi yung
Okay, sir.
feeling lang natin mataba tayo, but in the first place mataba naman talaga tayo. Alam mo yun? So
Sorry sa voice ko, sir. May ubo kasi ako. Namamalat.
oo, yun. Ubo pa rin. O, isa pa yan. Pag may ubo, ipahinga. Okay, anyway, going back, so it has to be clinically diagnosed and again, it has to go through diagnosis, so examinations, laboratories, and then makikita mo talaga, you will see from the laboratory reports that their nutritional value already decreases and then it's not healthy for them anymore. Okay, bulimic. So bulimic is a cycle. You eat a lot and then you puke or you vomit, and then you eat a lot, then you puke, you vomit. But anorexic, they do not eat at all. Okay, they're starving themselves to become super thin because they feel really fat. Okay, who else? Ray. Okay ka lang ba dyan, Ray? You're on mute.
Sorry, sir. Wala akong boses.
Oh, bakit? Ano nangyari sa'yo? Magkasama ba kayo ni Sarah? Okay,
Sir.
never mind na lang.
Sir, ano kasi siya? Kahit dito sa boarding namin sa boarding ng asawa ko, almost lahat sila may sakit. Nag-uubod dahil siguro sa weather change.
Oo. Be careful. Okay. Buti na lang din na nag-online tayo.
Online kaya nga, sir eh.
Okay, how about, okay na yun. Okay, fine. May hindi pa ba ako natatawag? Abdullah, how are you, Abdullah?
Alhamdulillah, fine, sir. How are you?
I am good, thank you. Mabuti naman.
Okay. Growth of development, I'm talking, like feeding for a baby. So, every two hours, we need to give them food for feeding, like milk for mother. Okay. So, after 6 months, we can give like soil food. Like that
Yes.
one discussion about.
Okay,
last week.
thank you. Let me just revert back to the first line. You said that every 1.5 to 2 hours, we should be giving the infant at least 30 ml of food. Okay, so please
Yes.
remember that because in the TESDA questions, if you're going for a TESDA exam in the Philippines, that will be part of the questionnaire. And aside from that, he also mentioned that after 6 months, you can now introduce solid food. But when I say solid food, hindi siya yung solid na solid. Okay, it's blended. It's parang.
Blended.
Yes, it's soft but not breast milk, okay? But still continue breastfeeding your baby with breast milk up to 2 years old. Aziz.
Hi, sir. Sir, we talk about also the kangaroo care. One way to maintain the newborn temperature, and father also can carry the baby, sir, in skin-to-skin contact.
Yes, it's very helpful, and up to right now, okay, every morning during when they're going to send the baby from the nursery going to the room of the mother, or sometimes if the condition of the baby is not really like 100%, it's medyo critical, they would ask the parents to go into the nursery. Okay, meron silang parang chair where they can do the kangaroo care while trying to teach them with breastfeeding. It's really just for emotional bonding. Okay. They said daw Kono, that you notice in the movie when somebody is trying to is delivering a baby, diba? Right after that is a baby boy, and then they put the baby in the chest of the mother. That's already because they want to form a bond between the mother and the child. But reality wise, sometimes if the mother and the baby is a surrogate, meaning that they're only paid to bring the child to the world, then they don't do that anymore because they don't want to create that bond between the baby and the surrogate mother. Okay, but it has to be discussed prior to delivery. Na, this is a surrogacy pregnancy, so I don't want to see my child and stuff like that. Okay, so that sometimes also happen. Okay, thanks, Aziz. Lujin.
Yes, good morning, sir. Good morning, classmate. The types of play in early childhood is the solitary play. It's between 0 to 1 to 2 years old of infant and children. They intend to play they intend to play alone with their toys, and they are not interested what others children play with. And the parallel play is the first step of learning how to interact children play with their toys. And the associate play, it's this play, it's with roles, and like playing in the playground, like they want to play with children with the swing and the slide. And the cooperative play is the preschool play, like they are doing activities.
Let me just correct that. The cooperative play is school age play. Okay.
Okay.
Not the preschool age play. All right. Thank you. Very nice. Next, sino pa? Palen. Can you speak, Palen? Wala. Siguro nagtatrabaho si Palen. How about,
Yes, sir. Nandito po
okay.
ako.
What did you learn, Palen? What do you want to share?
Ano po, introduction of solid foods.
Okay. What about that?
If you are giving solid food to your children, you have to wait at least 3 days every food so that you can monitor if they will have what's this? Allergies.
All right, perfect. Thank you so much. There's some noise on the background. Okay, anyway, now let's move on to our topic. Where did I stop last time?
Grieving, sir.
Grieving.
Grieving.
Grieving process.
Adulthood grieving.
Okay na, narinig ko na kayo. Okay. All right. So that is part of the late adulthood, right? So a lot of our clients goes through grieving process because this is the time where some of their partners already pass on and move on to the next part of their life, which is the afterlife. Okay. So again, I just want to reiterate regarding the physical changes of your clients. Please make sure that you review all of this and take this into consideration whenever you are taking care of an old patient, that they have limitations as far as their physical health is concerned. So be careful about that as well. Especially remember that when I've told you at the beginning, the pressure ulcer or the bed sores, this is really most common to the elderlies. Okay. Spirituality, that's already also another big part or chunk of their old adulthood life, because as you know, as you go older, you become more spiritual. So whatever is important for them, what matters to them, you have to respect that as well. Okay. If they have to exercise their spiritual needs, then you have to give them ample time for that. As long as it does not hurt them or you, then you have to respect that as well. Okay. Now, these are the activities that you can do, especially when you're working from home, how you can keep them active, sociable, and physically healthy as well, okay? Yan. And also mentally, parang may something dito na mag ano kayo ng mga games, mga puzzles, mga cross-stitching. Okay. So Givey process, you know this already, dabda. And then, as I've mentioned, this is not linear, hindi siya sunod-sunod in reality, and also sometimes it like goes like one after the other. Minsan naman depress muna, and then acceptance, again bargaining. So, but this is according to Dr. Kobler-Ross. So, siya ang may nag-study dyan. So, wala nating. If you want to know more, I have explained this in detail here on the slides. Okay, now let's move on. This is already the point in time where the old people or the late adulthood members do the self-review or life review, okay? So they will retrospect or introspect. That means that they will like evaluate how their lives went for the past 60, 50 years. So I hope na, well, I think that every milestone of our life, we have to review ourselves, where we are at right now, what we have achieved so far, what do you want to achieve in the future. But this is very evident sa mga old people na sana pala, what if? What if I said yes to that person? Sana pala si paring kuan na lang, Lu ang naging asawa ko. Yung mga ganun. Sana masaya ako. Or sana pala, I wish that when I was younger, I should be more brave to tell my boss that I don't like this job anymore and I will find something else. Or maybe when I was younger, maybe I could have divorced my wife or my husband because I don't want this life. Or maybe I should have been a doctor, or I should have been a priest, or maybe I should have traveled more. I should have be more confident about myself, stuff like that, right? Okay, never mind. Next, dementia. Did I reach this stage last time or wala pa?
Yep. Yes.
So tapos na rin tayo dito. Again, dementia is a big umbrella, right? It's a big umbrella, and one of the kinds of dementia is yung Alzheimer's, which is the most common cause, or which is the most common type of dementia. Alzheimer's disease, once meron ka na nitong positive ka for Alzheimer's, forever and ever ka na magka-Alzheimer's until the time that you die. So basically, the care for this is chronic or long-term. So can you imagine if you're the caregiver or CNA of this member or this patient rather, that from day one that they have been diagnosed with Alzheimer's, it will get worse and worse each day. So if ever that you're the primary caregiver, for example, you're the eldest daughter or the eldest son who's taking care of the parents who has dementia or Alzheimer's disease, you know the agony that you have to bear on your back from the day that they will be diagnosed until the day that they will die. Syempre mahirap yun. As being a CNA or a caregiver, guys, you have to really take care of your personal health, your psychological health, your mental health, and all that stuff, because otherwise, again, madidepress ka talaga with the situation. Okay. Okay. Now, fall is also a most common cause of yung mga accidents for elderlies, okay? So one thing lang talaga, whenever you're taking care of elderly patients, make sure that you always put on their side rails, okay? For example, you forget something to bring from your station to their room, make sure that you put the side rails back all the time. So if there's one of the 10 commandments being a CNA, one of that is to make sure that the side rails are on, or meaning it's up, okay? Pag mahulog si patient, don't worry, just buy the earliest flight back to the Philippines and take the Cebu Pacific and get your passport and go to back to Philippines. Okay, so there. Elder abuse, again, is the most common issue about them. So be careful lang talaga about this, especially nowadays with the advent of technology. There are hidden cameras, there are cameras, but even with or without cameras, make sure that also take care of your patients as if they are your parents. Okay, and there are more geriatric diseases. When I say geriatric, that means care for the elderly. Pediatrics, that's care for the children below 18 years old. So diabetes is very, very common. Ang magkaibigan kasi dito, guys, is diabetes and then hypertension, right? So if you have hypertension and if you have diabetes, boom, then it's a very nice combination, okay? Osteoporosis, again, it's most common. Chronic kidney disease, most of the elderly go through dialysis because their kidney is already damaged. COPD, chronic obstructive pulmonary disease, such as yung mga bronchitis, mga examples, mga ganyan. So ubod na lang sila ng ubo, and then especially for the smokers, or even lung cancer. Arthritis is very common, cancer as well, and then so. Now, so fast forward, namatay ng ating patient. The patient has died. Anyway, 100% of us will die. Okay? So if mamamatay tayong lahat, meron na ba kayong mga Saint Peter? Charot. Saint Peter is the key, okay, para happy ang death. Anyway, now, once your patient dies, number one question, who will declare death?
Doctor.
Doctor, sir.
And how will the doctor declare death?
After the ECG, after the
Yes, number one is ECG. Alam niyo yung ECG, guys, remember that, you know, heartbeat, they will put a machine and then they will read your heart activities. It will have a flat line. Toot, 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 toot. That is confirmed death. And number two is your pulse less. Wala ka na yung pulse. So whenever they check on your pulse, then wala na silang maramdaman. So that's death. Okay? That is number one step. The doctor has to declare the death and has to be written in the medical reports. And then number three, they have to order post-mortem care. So Elmira or Jennifer, please proceed with the post-mortem care as per the doctor's order. Okay? Now, without that, they cannot proceed with the post-mortem care. Let's talk about what happens when the person dies. So stage one, it's pallor mortis. So make sure to memorize at least the first four, guys, because one, it will come out in your exam. And number two, it will give you a better understanding of how you're going to take care of your patients. Number one, the patient or the dead person, they become color. I mean, their color changes, okay? So now declare na ang death and everything, and then they will start to, the patient looks more dead. Okay? What are the other terms of a dead body? Sige nga. How do you call the dead body in your language? Or as what you have known?
Cadavers.
Bangkay.
Bangkay in Tagalog. Bangkay in Tagalog. Cadaver is a term that's more commonly used in the school. So whenever you have a university, which is also, sorry, a hospital, which is also a university, sometimes the unclaimed bodies, they will give it to the school so that the students can learn from that. And then we call that cadaver. Okay, what else? Yun lang? Corpse. Okay, saan ba natin ginagamit ang corpse, Marian? More on when?
In our language?
Yeah. How about in your language?
Also, this one last.
Huh?
Our language is last.
Last. Sa amin
Yes.
kasi, in us, it's called bangkay.
Okay. In
What
our
else?
language, we call it a funu.
Funo. Ang funo, namatay na ang funo. Funo in Tagalog is tree. Anyway,
Oh, wow.
pumanaw. Yes.
Yeah,
Ano pa? Bangkay, pumanaw, patay na katawan, patayng lawas, yung mga labi. Di ba yung labi? Mga labi ni Fernando Po Jr., makita nyo sa ganito, which is more formal. But in English, guys, what we call that is corpse is number one, cadaver, dead body,
remains, sir.
the deceased, yes, the remains, the mortal remains, the remains, ayun. Okay, so there. So first thing what happened to them is yung pallor mortis nga. So from the word pallor, just remember pale, okay? Mary Palin, okay? Pale meaning that they will come not like your color right now, okay? Number two, algor mortis. When I say algor, it's called death chills. They start to become and feel cold, okay? So yun. So yun. And then stage three, this is around 2 to 6 hours after death, they become stiff, okay? Or stiff na or titigas na sila, okay? And then number four is called livor mortis, and then they become like a color of a dead body. Okay, so I will end it there. I only have less than 1 minute before this ends, so I will see you again in 10 minutes. Okay, so there. Okay, see ya.
Okay.
Boom.
Okay.